Hi everyone, Gary Coleshill here. Welcome to the long-term care planning webinar, how to protect your retirement from a chronic disability. My name's Gary Coleshill and I'm glad you're here today so we could talk and you can learn about long-term care planning. Not the most exciting topic, but a very necessary one. So bear with me and I'll try to keep you awake as we go through it. Firstly, important disclosure. The presenter, that's me, and the material being presented are in no way affiliated or endorsed by the federal Medicare program, Medicaid program, or any other government agency, any of the alphabet agencies. No part of this presentation is intended to make an offer of sale or purchase of any specific insurance product, and Senior Market Sales, who put this together, does not give tax advice. You should always consult a legal or tax advisor for advice and information concerning a particular situation. Every effort is made to provide accurate and up-to-date information. Now, here's what we're going to go over today to help you understand more about having a chronic disability. We will define what it means to have a chronic disability, okay? We'll discuss the consequences of an extended care event. We'll identify the options for care and add up the cost of care. Now, how many people in this room expect to need long-term care one day? Put your hands up. Let's see a show of hands there. Well, a couple of you. And that's not surprising that because really few of us do, because it's really hard to face the fact that our health might decline. No one wants to think that. But statistics do suggest the risk is greater than we think. Approximately 70% out of us, yep, that's right, folks, 7 out of 10, will need some type of long-term care services during our lifetimes at some point after we reach age 65. And though, of course, it's good news that people are living longer, a long lifespan increases the chance of developing serious health problems, obviously. In fact, according to the Alzheimer's Association, 1 in 9 people aged 65 and older actually has Alzheimer's, which is a horrible illness, which often leads to the need for nursing home care. And while older people are more likely to need long-term care, younger people can need care as well as a result of, disabling accidents or illness such as MS or Parkinson's. Now, this isn't meant to scare you, so please don't let it, but rather to remind you that the need for long-term care can happen to anyone at any time. The need to be prepared is real and something that you shouldn't ignore. Now, by a show of hands, who has a personal experience with an extended care event? Let's take a quick check here and see. Oh, only one, but okay. Who was the patient? Who was the caregiver? What was the impact on your family's health, and who or what paid for the care received? Important questions. So what is a chronic disability? It's an event that causes a need for care for an extended period of time. It also includes the broad range of services and support of people who are unable to care for themselves due to maybe an accident, heart attack, cancer, stroke, prolonged illness, or cognitive impairment, or as a result of aging and becoming frail. Now, long-term care is not just medical care, but it also includes assistance with the basic personal needs of everyday life, called the activities of daily living, ADLS. The inability to perform these tasks can happen at any age and for any length of time. The 6 common activities of daily living are washing, dressing, feeding, toileting, mobility, or transferring. It may also include some ancillary custodial homemaker services, such as help with daily chores, such as cooking, cleaning, laundry, paying bills, or medication management. Now, there are three primary levels of care. There's skilled care, which is medical or rehabilitation services, which are prescribed by a doctor and delivered by trained medical personnel. There's intermediate care, care and services to individuals who do not require the degree of care which hospitals or skilled nursing facilities provide, but require care and services above the level of room and board. And there's custodial care, informal non-medical caretaking provided by a friend, a neighbor, or a family member. This represents the majority of extended care services, and this doesn't require delivery by a medical professional. So who will care for you if you need extended care? Are you going to plan to rely on a family member? Do they know that? Probably important that they do, but anyway. So who will care for you if you do need extended care? A family member? Does your family member work? Do they have children or a family to care for? Can they physically lift you in and out of a chair, bed, or bathtub? Well, would you prefer your children manage your care and provide your care for you? Lots of questions to ask here. So would you prefer your children to manage your care or provide your care? Because this would give your family more control, for greater flexibility, and varied options for care. Have you thought about the consequences of providing long-term care? The emotional and physical well-being of those that you love may be compromised. It's tough. Long-term care impacts entire families, not just the person needing the care. Family members provide the majority of informal care. It requires time, willingness, and sacrifice, and it can take a physical and emotional toll on the caregiver. Now, what are the consequences? Well, for a family, the need for long-term care may impact the connection that you actually have with your family when a spouse or a child takes on the role of caregiver. It affects the ability to stay at home. When you can no longer manage to care for yourself at home, you may actually have no choice but to go to a long-term care or an assisted facility. And it also affects your retirement savings when the assets you worked a lifetime to accumulate must be used to pay for long-term care services. Now, where do you receive your care? There are four primary places where you can receive care: at home, at an adult daycare center, at an assisted living facility, or at a nursing home. Now, receiving care at home is the most common. The vast majority, 80% of elderly people receiving assistance, including many with several functional limitations, live in private homes in the community, not an institution. Care is often provided by a relative, a friend, or a professional home care agency. Community-based support services can supplement the care received at home, such as adult day care centers or transportation services. Adult daycare centers provide professionally managed environment care for older adults who may have dementia or physical limitations. It provides a safe and secure setting during the daytime hours. Now, amenities may include meals, medical services, cognitive stimulation, social interaction, and educational activities. Assisted living facilities are the fastest growing extended care housing option. They're designed for seniors who live independently but may require some assistance. They offer varying levels of care, but they don't offer the comprehensive medical services that nursing homes provide. Nursing homes provide skilled medical care and 24-hour supervision. There are currently 1.4 million people living in nursing homes in the United States. Now, for another very important question, how expensive are long-term care services? Well, if needed, the cost of long-term care can be alarming and financially devastating. The cost of long-term care would vary depending on where you live, where you receive the care. Are you at home, at a nursing home? The length of time you receive care for, and other needs specific to your situation. Many of these factors remain unknown until the time you need care, making it difficult to calculate the exact cost. The fact is, however, that long-term care is expensive, with costs continue to rise every year. Preparing for the unknown with an appropriate insurance product is one way to help you safeguard your future. Now, here are the national median daily, monthly, and annual costs for home health care, assisted living, and a nursing home. It's easy to see how the high cost of long-term care can threaten or even wipe out your retirement savings and jeopardize any assets you'd hope to leave to your kids or your grandchildren. Every year, many Americans are impoverished by the need for nursing home care. But here's some good news. With proper planning, you can avoid this happening to you. Over the past 15 years, the cost of care has really, really grown. This chart shows the cost of care trends from 2004 to 2020. So trust me, they're even higher now. And they're already quite staggering. So let's look at the average duration of care. Any service, 3 years. Assisted living, 29 months. Nursing home stay, 835 days. So that's 2.5, 3 years, almost. 20% of people will need care for longer than 5 years. But the good news on that, I guess, is that 80% will need care for less. But anyway, it's still quite concerning. As we talk about ways to pay for long-term care, remember that nursing home care is only part of the picture. Over a course of a lifetime, you or someone you love may need several different types of long-term care in different settings, and you may end up using several different strategies to pay for that care. So let's put this into a case study using today's cost of care with no inflation. Let's assume you or a loved one will need 18 months of home health care before moving into an assisted living facility for 2 years, followed with an 18-month stay in a nursing home. 5 years of care for one individual alone would cost over $335,000. And if your spouse needed the same level of care, the cost could exceed $675,000. How on earth do you pay for that? Unless you're mega wealthy already. This is a significant cost in retirement that you really need to plan for. So how can you pay for the high cost of an extended care event? There are 3 basic options for paying for long-term care, plus a new program that we're going to discuss today. And these are paying out of pocket and relying on government programs such as Medicare. Oh, bear with me here a second. Just had a quick message come through. Let's see what it says. Catherine, you raised your hand. Did you have a question? I don't see one. Would you like to talk? Is there something you wanted to say? Or was that accidental? Maybe it's accidental. Okay, if it's something you want to ask, just put it in the chat box and I'll see it. But we'll move on. Okay, I think I muted myself there. The first option we're going to look at for paying for this care is paying out of pocket. Paying out of pocket means you're using your own income, your savings, investments, and assets, such as your home, to pay for long-term care. Now, I like to call this the default option because most people don't actually decide that they're going to pay expenses themselves. It just simply happens that way because they haven't put together a long-term care plan. The major advantage of paying out of pocket for long-term care is you do have better control over where and how you receive care than you do with other options. For instance, a long-term care insurance policy may cover only home health care workers who are licensed professionals, but when you're paying for care out of your own pocket, you can hire anyone you want. Obviously, this flexibility is ideal if you can actually afford to pay for your own care indefinitely, which few people can. But counting on being able to pay out of pocket is really a gamble unless you're wealthy. You're betting that you'll be able to afford to pay for the care you need, often using the money that you saved for retirement. But counting on being able to pay out of pocket is difficult. What if your gamble doesn't pay off and you deplete your life savings? That can be a major challenge. Will you be able to sell assets that you hope to leave to your children or grandchildren or to charity to raise the cash you need? And keep in mind that once your money's gone, you have very few options left. You may have to rely on family members for care and support or rely on Medicaid, a government program, to pay for your care. Even though Medicare and Medicaid sound the same, they're not. They are separate programs with different coverage and eligibility requirements. Medicare is a medical-based insurance program provided by the federal government to all citizens aged 65 or older, regardless of income. It covers basically a very limited scope of long-term care services and doesn't cover non-skilled custodial care, which makes up the majority of long-term care. Medicare can pay for up to 100 days in a skilled nursing home if the stay is preceded by a qualifying hospital stay of at least 3 days. On the other hand, Medicaid, is a public assistance program for people who have met strict income and asset qualifications. It pays mostly for custodial care in a skilled nursing home setting, and often is a program of last resort. Medicaid recipients may end up having a limited choice of care options due to the number of beds available in their area, and spend-down strategies to qualify for Medicaid can often lead to hidden pitfalls, including a 5-year look-back period on asset transfers. So not simple at all. So what is long-term care insurance? It's private insurance that pays benefits if you need extended care. Like other types of insurance, long-term care insurance protects you against a specific financial risk. In this case, the chance that long-term care will wipe out all of your life savings, while paying for out-of-pocket may be ideal if you're wealthy, and relying on Medicaid may be an option if you're poor and you can qualify right away. Long-term care insurance is an alternative that is especially valuable for middle-income Americans who want to preserve their financial independence and quality of life. And no matter what your income level, long-term care insurance gives you the freedom to choose where you receive care. A comprehensive long-term care policy will cover home care, assisted living centers, adult daycare centers, and nursing homes. If you need nursing home care, you'll have a wider choice of facilities than if Medicaid was paying for your care, since many nursing homes give preference to patients who can pay for their own care. Long-term care insurance can also help you preserve the assets that you've accumulated. With insurance covering most of the bill, all of your savings won't be spent on long-term care. Now, today, there are a lot more insurance options than in the past, and one of the fastest growing segments are hybrid solutions, which offer annuities with long-term care riders, life insurance with accelerated benefit riders, and life insurance long-term care combination products. And we can't forget the traditional long-term care insurance option, which is still a great value should you need long-term care. In order to buy a long-term care policy, you must be in reasonably good health. Once you develop health problems that may result in the need for long-term care, you'll have trouble qualifying. The premium you pay for a long-term care policy is based on your age at the time that you purchase the policy and the features and benefits you've chosen. That's very important because basically long-term care is cheaper if you get it when you're younger and have less health problems. In exchange for your premium payments, you receive a promise from the insurance company that if you need extended care, that your insurance company, not you, will actually fit the bill. To receive benefits, you must be chronically ill or cognitively impaired and need help with at least 2 out of 6 activities of daily living. Now, these activities are typically bathing, continence, dressing, transferring, feeding, and toileting. And before you receive any insurance benefits, you'll need to satisfy a waiting period. Now, this period is called an elimination period, and it works like a deductible. During this time, you'll have to pay for long-term care expenses yourself. So you should be prepared to pay for part of your long-term care costs, even if you decide to buy a long-term care insurance policy. Once you start receiving benefits, they'll continue to be paid for as long as you need care or until the policy limits are reached. Okay, moving on. Had a sticky slide there. Traditional long-term insurance plans offer standalone policies that can be customized to suit your needs. It provides a pool of dollars that pays a benefit if you become cognitively impaired or require assistance with 2 out of the 6 activities of daily living. They're also guaranteed renewable. As long as you pay your premium, you're going to have coverage. And they have options, they're comprehensive, there's short-term recovery care or home health care. Premium is based on age, health, and features and benefits you choose. Typical policy options are monthly benefit amount, benefit period, waiting period, and inflation protection. Now, long-term care insurance is not the only option available to pay for extended care. Some life insurance or annuity policies also offer long-term care benefits. These policies combine the benefits of either life insurance or fixed annuities with the options to use some of all of the contract value to pay for long-term care expenses. So if you don't use the long-term care feature, you'll either have a death benefit payable to your beneficiaries or an annuity that you can use yourself to supplement your income, but you're most likely to need a lump sum of at least $50,000 to buy a combination policy, and you can't deduct the premium as a medical expense. So let's begin putting the pieces of the puzzle together for your own plan of care. To get a sense of what the future may hold, find out what facilities and services are available in your area. I'd even suggest visiting some of them if you get a chance and find out what they cost. Then take a look at your finances and think about what we've discussed. Do you have enough money to pay for long-term care out of your pocket? If not, Do you need more information about Medicaid planning? Or are you interested in buying a long-term insurance policy, long-term care insurance policy? And as uncomfortable as it may be to do so, raise the issue with your family. Talk to them about how willing they are to provide care when the time comes, if you're comfortable with that option. Next, get expert advice and help with putting together a strategy that will meet your needs. Finally, meet with your attorney and prepare healthcare directives such as power of attorney for healthcare. Now, this is a document that will outline your wishes for care and allow you to designate someone to make decisions on your behalf should you become incapacitated. It's important, yet sometimes overlooked way to retain some control over your own care, even if you do face serious health issues. Nothing is more expensive than regret. No one knows when the need for long-term care services will arise, and it may be smart to buy a policy when you're young and in good health. The cost is based on your age, so it may never be more affordable than now. And a change in your health may leave you unable to purchase a policy at any price. As we draw near to the end of this webinar, I want to review a few of the reasons why you should begin planning for long-term care as soon as possible. Of course, it's never too late to plan, but here's why planning as early as possible makes a lot of sense. Although it's hard to face the fact that health problems may someday result in a loss of independence, we can't predict the future. Are you willing to gamble that you'll stay healthy forever and that you'll never need long-term care? If you begin planning today, you'll have more options open to you, including the opportunity to purchase long-term care insurance. Another reason to begin planning now is to allow yourself enough time to plan for Medicaid. Planning ahead can allow you to retain more control over where you receive care and may allow you to qualify for Medicaid more quickly. Finally, by making decisions today about long-term care, you can relieve your family of the burden of having to make decisions later. Keep in mind that when confronted with a crisis, people often make wrong decisions based on emotion that can lead to family conflicts and inadequate care. Now, when we wrap up, as you'll be in a few minutes, and we sign off, a short survey will appear in your browser. If you'd be so kind as to fill it out, we will send you this great book, The New Holistic Retirement, which will help you plan, for the future you, basically. It's 122 pages, well worth a read, some great ideas in that. And to get it for free, all you have to do is fill out the questionnaire at the end. And also, I'd like to let you know that I do have another webinar coming up this week, which is actually tomorrow, on short-term care. Basically, short-term care is an alternative to long-term care that gives you less benefits, but it is a lot less expensive. So you may want to take a look at that as well. It will guarantee you less time in nursing homes, etc. But it's if affordability is an issue, it's certainly an option. So if you'd like to join me for that, just type or write into the survey that pops up short-term care, and I'll send you an invitation to that as well. Hope to see you there also. So thank you very much for everyone being here today. I hope that did give you some idea of what to expect. I know it's a bit of a complex topic, but if you have any questions, feel free to call me. My number's on the screen, which is 480-208-4366. You can call me on that, and you can also text me on that. And if you go to tinyurl.com/retirement offer, you can also access the free book on that site. And that's about it. If you have any other questions, call me or email me. I'd like to thank you for spending the time here with me today. I hope that that helped you to clarify how you feel about long-term healthcare. And watch out for that survey. It will be popping up in just a moment.